Respiratory system. We know that hormonally speaking, progesterone again relaxes smooth muscle. So it relaxes the lungs. It decreases the airway resistance so that more air can come into the lungs and there can be more gas exchange of oxygen. We know that estrogen increases vascularity. And what does that do? Well, the vocal cords get involved here, and increased vascularity actually causes the vocal cords to make voice changes. It lowers the voice in mom. The increased vascularity in the mouth increases vascularity in the gums. So mom has more bleeding gums. She brushes her teeth and they bleed. She eats, sometimes they bleed. As she flosses, they bleed. So that can give rise to gingivitis, okay? And with bleeding, there's bacteria that can enter, right, the gums. And it actually can enter her bloodstream. And it actually can cause preterm labor because when the bacteria goes to the uterus, it increases the production of prostaglandins, and that causes contractions. Epistaxis, do you guys know what that is? Those are nosebleeds, all right? Increased vascularity causes nosebleeds right and left during pregnancy. So if mom comes to the ER with a nosebleed, if she's not hemorrhaging, we fix it for her, we send her on her way and say, hey, that's part of pregnancy. Okay, we can tell her to use some Vaseline or some nose spray to keep it moist in there, but it is a common symptom and complaint of pregnancy. So here we've got progesterone and here we've got estrogen. I want to go to, let's go right over here first. O2 consumption. We said decreased airway resistance, so more air can come in and more gas exchange. So the O2 consumption is oxygen is needed because the fetus needs it, the uterus needs it, the breasts need it. There's increased respiratory demands during pregnancy, increased cardiac demands. And so in order to compensate for those things, her respiratory depth increases. She can inhale deeper because of this decrease in airway resistance. She can inhale more and her minute volume. So everything increases for the sake of providing more oxygen, more gas to the baby and to mom's body. So physical changes. The increased uterine size ends up pushing up on the diaphragm. After it gets to say 20 weeks, is at the umbilicus, it starts going higher and it starts pushing up on the diaphragm. So when that happens, the lung expansion decreases. Lungs can't expand as much, but there's more. The compensation for that is that the ribs flare. So, normally, do you know what the substernal arch is? The substernal arch is, I'll put it over here so you can see it, is where the ribs meet in front, right here. And the arch, the angle is right there. So when the diaphragm raises, when the lungs can't expand down below, the ribs flare and that substernal angle widens so that it compensates and she can get more air in. So the chest circumference is larger. Now, it's larger side to side, not front to back like your COPDer, okay? All right, next. Cardiovascular. Progesterone relaxes smooth muscle. So in the vascular system, okay, it decreases peripheral vascular resistance. What does that mean? You guys remember that from 172? It allows more blood to go down to the lower extremities, and it can actually cause some swelling because of that later in pregnancy. But it relaxes so that more blood can go there to keep a blood pressure stable despite all this increased volume that is going to take place. So let's come over here, and then we're going to go back to the stable BP. Estrogen stimulates renin, okay, the renin-angiotensin system. So it increases sodium and water retention, and plasma volume increases by almost half, almost 50% by 32 weeks. So this volume increase, she's got all this extra volume. Her blood pressure would be elevated if it wasn't for this, where you've got decreased peripheral vascular resistance. So increased peripheral perfusion sort of balances things out. Blood pressure should remain stable. Okay, and because of the increased volume, we've got increased stroke volume, increased workload of heart, increased cardiac output, slightly enlarged heart, interestingly enough. This heart's working very hard, more volume, plasma volume. So it enlarges a little bit and it gets displaced to the left. And so with the raising diaphragm, okay, it pushes it up and it gets displaced to the left. So sometimes if you're listening to mom's heart, you have to listen a little bit over more left than you normally would, you know, where you've got Erb's point over here, right by the sternum. And it might be over a little bit more lateral. All right, so with plasma volume increase, you get this physiological dilutional anemia. And you've got more plasma. So even though you have more red blood cells, the hemoglobin may look lower on the lab. So it may be an 11-gram hemoglobin. We don't get too nervous about that. If it drops below 11 grams, then the provider will probably give her some additional supplemental iron to take, because we don't want her anemic at the time of delivery. She's going to lose blood. This physiological dilutional anemia causes a physiologic murmur during pregnancy. There's just more volume going through. So it gives more of a swish, and it can cause a normal benign murmur. There's also a normal benign splitting of S1, the first heart sound, the lub of the lub dub. Okay, so increased GFR, okay, glomerular filtration rate in the kidneys because of the metabolic waste that takes place. So the volume, there's more volume that has to go through the kidneys, so it increases its rate. Now, with this increase in rate, the tubules cannot reabsorb all the increased sugar that's in the system. So what happens is mom ends up spilling sugar in her urine. This is extremely common, especially if she's eaten something with a high amount of sugar in it. I would always ask patients, when I saw patients in the office for their prenatal checks, if we always did the dipstick, right? Glucose and protein dipstick every time you see a pregnant person. So if the sugar was elevated, I would always ask her, what did you have for breakfast? And typically it'd be a donut or frosted flakes. Anyway, something high sugar content. Now, if it continues over time, if it's not just once or twice, if it continues over time, gets higher, then we start testing her for gestational diabetes. Increased glycosuria will increase bacteria, because bacteria love sugar, right? And so mom is at risk for UTIs. Okay, back up here. With increased plasma volume, there's increased nutrient transport and reserve for blood loss. You know that the blood components increase, and we've already talked about renal perfusion. Whew, that was a lot. Okay, next slide. GI. So with the GI, again, I'm going to start off with progesterone and then go to estrogen, and then we'll branch out. So progesterone affects the stomach and the small intestine and the large intestine, but let's work our way down the small intestine first. So the sphincter that is at the top of the stomach, the esophageal sphincter, the tone in it relaxes. So acid gets regurgitated easier in mom. So she develops heartburn. Heartburn during pregnancy is normal. And her provider can give her some guidelines for that. The motility decreases in the stomach as well as the small intestine. And so there's slower emptying time. Now, this is really, really cool because it slows so that there's an increased amount of nutrient absorption for baby, okay? Benefits the baby that this slows down. All right, let's go to the large intestine. We've got decreased motility here too. The decreased motility here is so that there's increased water absorption, because remember, the small intestines absorb nutrients, the large intestine absorbs water. And so when mom's system does this during pregnancy, she gets constipated. She's at risk for being constipated and developing hemorrhoids due to this. So we need to know how to educate her with all of this that's going on. That's going to be important. You need to know that. All right, let's switch over to the gallbladder. Okay, same thing, decreased tone, decreased emptying. So decreased emptying means increased risk for gallstones. Do you remember learning about gallbladder disease and gallstones and the 4 F's, female, fat, fertile, and there's one more, female, fat, fertile. You guys are probably saying this out loud right now. It'll come to me, but let's keep moving on. And so mom is fertile. She's pregnant, right? She's female, okay? And she's got a little extra weight on her. So she is at risk for gallstones. So when a pregnant patient comes in complaining of abdominal pain, we cannot assume it is the uterus. We have to rule out, is it gallstones? Is it appendicitis? Is there something else? Is it GERD? What's going on? Okay, increased bile salt retention, which can cause itching in mom. If she has a lot of bile salt retention, it can actually enter the bloodstream, which is not good, because then that can go to baby, and that can cause, it's like a teratogen to baby. It can cause a problem, preterm delivery, stillborn. So we pay attention to this if she's got a ton of itching going on. All right, estrogen over here. Hyperemia, okay, we talked about that with the mouth and gums, gingivitis, and bleeding. Urinary, the bladder and the kidney, estrogen and progesterone pretty much do the same thing. Estrogen grows the bladder and the kidney because the bladder needs to hold more, the kidney needs to produce more, so both of them hypertrophy. And progesterone decreases the tone of both. It relaxes them so that they can maintain more, hold more, and do the growth, make the growth possible. But the problem here is that with the kidney and the bladder, there's increased stasis. So with increased stasis, there's an increased risk for a bladder infection and a kidney infection. So just know that. A kidney infection, I want you to think about, where would mom complain about a kidney infection? I want you to try and come up with that before I say it. Okay. Let's go to the next slide.